Your doctor submitted a request for a procedure you need. An algorithm denied it. Not a doctor, not a nurse, a machine. A machine said no. And that decision was final unless you fought back. That's not a hypothetical. The Federal Office of Inspector General investigated Medicare Advantage plans and found that 13% of prior authorization denials involved care that met Medicare's coverage rules and should have been approved. 13% across millions of decisions every year. That's not an error, that's a pattern. Now, most people think the denial letter is where the problem starts. It isn't. By the time you receive that letter, the decision has already been made, automatically, by a machine trained to protect the insurance company's bottom line. Now, I did a previous video on what you can do when you get denied, including how to use a free AI tool to build a professional appeal, whether you have a Medicare Advantage plan or a prescription Part D plan. But today, I want to zoom out because there's a much bigger story happening here, and it affects your care before you even see that denial letter. So here's what's actually happening inside Medicare Advantage plans. Every year, insurers process tens of millions of prior authorization requests. Doctors and hospitals must ask permission before providing care. And millions of those requests are denied, fully or partially. Now consider this, a 2022 American Medical Association survey found that physicians spend nearly 2 full business days per week dealing with prior authorizations. Not treating patients, not reviewing results, managing paperwork for an insurance approval system. Now here's the financial reality. Medicare Advantage plans are run by for-profit insurance companies. Their incentive is not your health outcome. Their incentive is cost management. Every denial saves money. Every delay reduces care delivered. That's not speculation. That's how the model works. And AI has made this process faster, more scalable, and more invisible. Those systems use machine learning to review requests automatically. They flag cases outside of preset parameters, and in some cases, they issue a denial before any physician reviews your situation. This is the new reality inside of Medicare Advantage plans. Now, here's where it gets interesting. When care is denied, the patient isn't the only one affected. Hospitals and physicians are affected financially too. Because when your procedure doesn't happen, they don't get paid. That created an unexpected response. Healthcare systems are now deploying their own artificial intelligence, specifically designed to counter insurance companies' denials. Now, 3 ways this is happening. First is predictive denial analysis. Before a request is submitted, hospitals' AI scans past denials and fixes problems in advance. Second is AI-assisted documentation. So doctors use AI to improve clinical documentation aligned with what the insurers look for. The facts don't change, but how they're presented does. And third is automated appeals. When a denial happens, artificial intelligence generates immediate responses, citing exact criteria, rebutting the clinical evidence faster than any human could. So what you're watching is an arms race. Insurers' AI denies faster, hospitals' AI responds smarter, and the battleground is your healthcare. Now for the interesting part. Just when this looks like a 2-player system, a 3rd player enters the field, the federal government. So the federal government is now testing artificial intelligence inside of Original Medicare. And what Medicare is doing is a pilot program called the WISER, W-I-S-E-R. Now think of it like a double agent. It uses AI to evaluate claims and flags services it considers unsupported. And the goal is to catch fraud early. So CMS, which is Medicare, states that human reviewers remain involved in the final decision. And importantly, this system is also being developed to identify denial patterns inside of Medicare Advantage plans so that they can be challenged in real time. Original Medicare operates under a different mandate than a Medicare Advantage plan. Original Medicare is designed to cover medically necessary care, not optimize cost. Programs like this are meant to reduce fraud, not deny necessary treatment, and that distinction matters significantly. So before I continue, I want to hear from you. Should an insurance company be allowed to use AI to deny your doctor's recommendation? Just comment yes or no below, and I read every response. So what does this mean for you? You're sitting between two financial forces with opposing incentives. Insurance companies want to limit costs and do so by limiting services, and hospitals want to deliver care. AI has amplified both at the same time. But here's the shift. This technology is no longer limited to institutions. It's now available to individuals. So you can now generate professional evidence-based appeals the same way the hospital does, and you don't have to navigate a denial alone. If you're on Medicare Advantage, prior authorization is becoming a bigger part of your experience. Understanding this system gives you a fighting chance. If you have a Part D prescription drug plan, these same tools can actually help you appeal drug denials. And I have a video on that. It'll be linked up in here. I just recently did. So if you're choosing a hospital, it's now a reasonable question. Do they use AI to fight insurance denials? And if you're comparing Medicare Advantage plans to your other options, so this is not a theoretical risk anymore, of course. The denials are real, but your risk is now less because you have better tools to fight that. So now let's look at Original Medicare with a supplement. And this is where the difference becomes very clear. No prior authorizations for medically necessary care. No algorithms between you and your doctor and your treatment. No insurance company overriding your doctor's decision. When your doctor says you need a procedure, Medicare covers it. And that is still how Original Medicare works. And in a world where AI denials are increasing, that predictability with your Medicare supplement has real value. So here's the bottom line. AI is now embedded in healthcare decisions at every level. Insurance companies are using it to deny faster. Hospitals are using AI to fight back. And the government is testing it. And you now have access to it. So the question is not whether AI will be part of your healthcare. It already is. The real question is, will you understand how to navigate it or be caught off guard when a machine makes a decision about your healthcare? If this has helped you understand what's really happening, please share this video on social media. Share it with someone on Medicare. And if you know somebody with a Medicare Advantage plan, most definitely share it with them. They need to see this. And before you go, tell me, should an insurance company be allowed to use AI to deny your doctor's recommendation? If you haven't answered that, please do so. Just comment yes or no below. I would love to see how that survey comes out. I'm Matthew Claasen with Medigap Seminars, and I'll see you in the next video.